Good morning, everyone. Thank you for joining us this Monday morning, May 9th, for a Facebook Live program with Indiana SHIP, the State Health Insurance Assistance Program. I'm Susan, and I'm joined by my co-hostesses, as usual, Melanie Garland and Megan Rogers. And we have a very special guest with us this morning, Gregg McAllister. Gregg is a good friend to SHIP. He works for CMS, the Centers for Medicare and Medicaid Services, and he's joined us this morning from Chicago, where it's an hour earlier, by the way, to talk to us about what is CMS, what does it do for older adults, because you may or may not know that May is Older Americans Month. So we're going to have some special programming the rest of the month to recognize that. So we thought, who better than to invite the federal government representative from CMS to join us this morning. So Gregg, thanks so much for making time to come on our Facebook Live this morning. And we're looking forward to hearing about how CMS works with older Americans, works for older Americans, and where it all fits in the grand scheme of government services. So welcome. And ladies, welcome to you too.
Thank you, Susan. Happy to be here.
Thank you. So tell us, what is CMS?
CMS is the Centers for Medicare and Medicaid Services. We are a federal agency under the Department of Health and Human Services. I have a few slides. Would you like me to just show you some introductory slides that I can?
Yeah, that would be great.
About who we are?
Seeing it and hearing it at the same time helps it sink in.
All right.
And folks, while Gregg's bringing up his presentation, do feel free to text us or chat in or comment in any questions you have for him.
Bear with me just a second.
No problem. We'll just, since it's coffee and conversation, we'll just all drink some coffee.
And this is going to be part of a larger presentation, so I don't need to show you all of it. So let me, okay.
And Gregg, I just want to say, I am also an hour ahead down here in the southern part of the state. So we both had to get up early today for this one.
Yeah, I forgot about that little bit of southern Indiana's. Northwest and Southwest Indiana.
That's right. Yes.
Okay. Can everyone see my screen now?
Yep.
Thank you.
All right. Okay. This screen is the U.S. Department of Health and Human Services. That is the federal department that CMS falls under. And this slide shows all of the various agencies that fall under the Department of Health and Human Services. Some of the ones more important, or not more important, but more that you know better, the National Institutes of Health, the Food and Drug Administration, those are, and the Centers for Disease Control and Prevention, the CDC. Those are probably the three other organizations that most people are more familiar with, the general public. My hosts, the SHIP program, are very familiar with the Administration for Community Living, ACL. ACL is the federal agency that gives SHIPs their money to do the important work that they do, letting you know about the Medicare program. You are our Medicare ears on the ground and our Medicare counselors, and we couldn't administer the Medicare program without you. We're very thankful to have you.
You're welcome. We're happy to do it.
Xavier Becerra is the Secretary of the Department of Health and Human Services. So he oversees all of the agencies that were on the previous slide. And CMS, Centers for Medicare and Medicaid Services, we got our name CMS, Centers for Medicare and Medicaid Services, before there was a health insurance marketplace. So now we're really kind of, we call ourselves the 3 M's that we administer: Medicare, Medicaid, and Children's Health Insurance Program, or CHIP, and the marketplace in states. And so that's what we do. We oversee and administer Medicare and the health insurance marketplace in states that use the federal healthcare.gov platform. Some states, Indiana is one of those states. Many states have developed their own marketplace platforms, and they oversee their own plans in partnership with us. And we work with states to administer the Medicaid program and CHIP and the state-based marketplace. So every state runs their own Medicaid program, but they do so following basic CMS rules. And so we work with them. So, and for all of our programs, we do try to fight fraud and abuse, make sure that anytime you have a federal program, there are going to be people who try to defraud that program. So we try to stop that. And Medicaid and Medicare have been around. The law was passed in 1965, and both programs went live in 1966. When we started, Medicare had about 19 million people in it. Today, there are over 62 million people in Medicare. When Medicaid started out in 66, there were about 4 million people, and now there are 76.5 million people in Medicaid programs. And that number varies month to month as people go on the program, get off the program. But it's remarkable how much the overall number stays pretty similar. Then in 2010, the health insurance marketplace was voted into law, and we started running the marketplace in 2013, outreach and education for the marketplace to get people to sign up for coverage at the end of 2013 for coverage that started in 2014. And today we have this is an old slide, we have about over 12 million people in the marketplace now in 2022. And CMS, we call ourselves one CMS, but we do operate in many different locations. Our main headquarters is in Baltimore, and we have 10 regional offices throughout the country. I am in the Chicago regional office in green there, and those 6 states are the 6 states that we work with as part of CMS. So that's Ohio, Indiana, Illinois, Michigan, Wisconsin, and Minnesota. So those are the states that we work with most closely. I can briefly show you a little organization. The organization chart on our Medicaid, on our CMS, is going to be a bit of a jumble. You're not going to be able, I'll get to that in a second. I'll show you that. And Chiquita Brooks LaSure, she is the CMS Administrator right now. She was just recently, she's been Administrator for about a year or so now. And under the leadership of Secretary Becerra and Administrator Brooks LaSure, we have established our framework for how we want CMS to operate. We call these our 6 strategic pillars, and they are to advance equity, where that means to make sure that all people have the same access and the same ability to improve their health, regardless of race, gender, sexual orientation, and other factors, and where they live, whether they live in an urban area or a rural area. Our second pillar is to expand access. We also work to engage our partners, which is what brings me here with your group today. We want to drive innovation to make our programs work better to serve the people that we serve, and protect the programs and foster excellence. I don't need to show you that. You don't need, this is not a quiz. So I will, this here, this is our organization charter. This is just so it's a lot. I'm not going to read it to you, and I don't expect you to read it or memorize it or anything, but this just gives you an idea of these are all of the, I guess we call them the box tops, the division tops. These are all the various divisions that make up the Centers for Medicare and Medicaid Services. And we all exist somewhere on that organization chart. So we are a big agency. We are responsible for, I'm not sure if we have more of the federal budget than the Department of Defense or just under, but we're up there. We're like, as far as expenditures, we are about the biggest federal agency out there. And we, in all of our programs, Medicare and Medicaid in the marketplace, we insure over 155 million Americans. So that's almost half the country are in one of our programs. Sometimes they're in more than one if they can be in Medicaid and Medicare at the same time. But that's we are the largest insurance company in the country. So that is very basically what we are, who we are. If you have any questions about us or the work we do, I'd be happy to answer them.
Well, of course, I have questions. And I had no idea that, I've been thinking about it. CMS has to be huge, if only, just administering Medicare and Medicaid. I wasn't aware that CHIP fell under there, but that does make sense. So, being out in the field, working with older adults, people with disabilities who receive their insurance through Medicaid, sometimes folks have some trouble finding, here in Indiana, they have some trouble finding providers who accept Medicaid. And, the word on the street is because Medicaid has a pretty low reimbursement rate. I don't even know what the reimbursements rates are, but who sets the prices that the government pays for its various types of government insurance like Medicare and Medicaid?
Well, CMS sets the rate for Medicare, but the rate for Medicaid services are set by the state. And I mean, every state is going to have fiscal constraints. But basically, treating people with Medicaid does tend to, Medicaid does not reimburse as much as Medicare generally. And Medicare typically does not reimburse as much as private health insurance plans.
Right. And that kind of makes sense, really. Also, with the marketplace, we have a lot of clients who have benefits and receive their insurance under the healthcare marketplace until they become eligible for Medicare. So those folks usually have, it's a big change going from the marketplace to Medicare, and we help them with that segue, and we help them understand what their new benefits are going to be. But a lot of people are getting tax credit, advanced premium tax credits to help them pay for their marketplace. So sometimes they don't really know the value of the insurance they're getting because they're not paying for the whole premium. And I've just always wondered who sets those tax credits. I know it's changed here in the last year where people can get some more tax credits to help them pay for the marketplace, but how does that figured?
Oh, wow.
Okay,
you need to be an actuary to know that, to get the official answer, but I can describe it very generally. Basically, and the marketplace is, first of all, it has formed a very important bridge for people from their working lives to Medicare. Many Americans are working later and later in life, and many are still working when they turn 65 and become eligible for Medicare, but many people still are able to and prefer to retire earlier than 65. And getting health coverage can be difficult, and the marketplace is how many people do that before they're ready for Medicare, eligible for Medicare. You're right, there are premium tax credits available to people in the marketplace based on their income. And everyone on the marketplace who meets them is eligible for the premium tax credits, but based on what you estimate your income to be, you can get those tax credits in advance. We call those advanced premium tax credits. And the amount of that is based on some very complicated formulas. Basically, it is that your household is based on the expectation that your household will spend a certain percentage of its income on health insurance. And just basically speaking, what your projected income for the year is in relation to that percentage of income can determine what advanced premium tax credit you're eligible for. And that is in relation to a baseline plan on the marketplace, which is what the second lowest priced silver metal level plan available in your area. So marketplace plans are sold by metal level, bronze, silver, gold, and platinum, where actuarially bronze level plans offer the least amount of coverage, like 50 or 60%. And then silver, bronze, and gold offer more actuarial health coverage. So and they get generally more expensive. And as you go up a metal level, and silver level plans are considered to be pretty close to the level that many people get through their employer coverage, if they have employer coverage. So that's the baseline. And the second cheapest silver plan available in someone's area is what determines the amount of tax credits a person is eligible for. So that's going to vary by part of the state you live in, by which state you live in, a lot of factors.
Okay, so it sounds like it's kind of the tax credit, the amount of tax credit is applied to kind of protect you from spending too much of a percentage of your income on your healthcare insurance.
It is, it's right, that's correct. Most people who have employer-sponsored coverage, their employer helps pay a portion of that premium, which is the reason that people like me can afford health insurance, because my employer pays a portion of it. People in the marketplace typically don't have that. There is an option for employers to offer coverage, small business owners to offer coverage for their employees on the marketplace. It's called the shop, the marketplace shop. But most people, there aren't very many people enrolled in that of our 12 million people with marketplace coverage. So, so that's meant to make it more fair, to make it more similar to how people with employer coverage get their coverage. It's not because most people couldn't afford the full cost premium without assistance.
Right. Well, thank you. And for many people, if it weren't for the marketplace coverage, they would go without insurance. So it is appreciated, and we meet people every day who have marketplace who are aging into Medicare. So thanks for that.
Yes.
Ladies, do you have questions for Gregg?
I have a comment. We just kind of mentioned with Medicare, and some people, work later and take their Medicare past 65. And then some people are wanting to retire earlier and, that 62 age or so it's just kind of important, to kind of know your coverage choices when you are looking at retiring, or if coverage through your employer, like what your options are. So we meet with a lot of individuals, and especially during the pandemic, we met with a lot of people about enrolling in Medicare. And so one of the hot topics was, well, I'm still working, but I'm turning 65. What do I need to do? Or, on the other side is I want to retire. What do I need to do, but not quite yet 65. So that marketplace was like super important. And then on the other side, like I'm turning 65. I want to start Medicare, but I don't want to collect Social Security. So like understanding the differences between that you don't have to have both, to get one, or you can have both. So those are some of the things that we kind of counsel on, and a lot with just kind of during the pandemic, and even more so, now, just a lot of people were just looking for those answers. And so we definitely appreciate the support and the clarity of when do I need what, and what is this, and how, because frankly, it kind of comes down to dollars sometimes, So the way the marketplace was explained, that made sense. Like with, well, I have health coverage through my employer. So my employer pays a portion. So that really made sense with the marketplace, that tax credit. Like I never really understood that. So that made sense.
Yeah, the Medicaid program it's a complicated program, as you know, right from the beginning, from those decisions that you're talking about right there. When do I enroll? Those are complicated issues, and Medicaid or Medicare is a complicated program, and that's why you are essential part of this equation. You are available face to face. Are you face to face now? But
we've always been face to face. We
right.
had barriers up, we had social distancing, but we have been on the ground this whole time for people.
Yeah, the information that you give to people who are considering their Medicare options, when to enroll and what to do, or I'm almost Medicare, what can I do? It's invaluable. And as our counselors on the ground, I mean, CMS is a large agency, but we don't have enough people to do the work that you're doing. And it's so appreciated. And we know that you have a lot of people who do the work you do are your volunteers, and you can't thank them enough. I mean, I guess they get something out of it too. They get to learn more about this complicated program that's Medicare. But there's a lot to consider when you need to sign up for Medicare.
Right, and there are some. What we find that there are just some really important dates and time limits, and sometimes if you let those go past you, because even if it's just out of ignorance of not knowing the rules, you can't unring those bells. So we like to get to folks before they turn 65 to make sure that they know what the real rules are, not what their neighbor told them, or not what they understood from a commercial on TV, those kinds of things. So that's a constant battle.
It is, and there's a lot of misinformation. I mean, whether it's people speaking and don't really understand the program themselves, or there's people who try to present the Medicare program as something a little bit different than what it actually is. There's a lot to keep straight, and that's what you do so well. So we appreciate that.
Well, thank you for that, and we appreciate all you do too. We know you don't meet with clients a lot, but there's more to a huge program and its administration than face-to-face or virtual meetings with clients. So you and all of those other departments, including the Administration on Community Living, allow us to do what we do and do what we enjoy doing. So
absolutely. I always tell folks that SHIP is your, your local resource. And I kind of say, we're the solution for not having a Medicare office. You visit Social Security online, in person, thankfully now, or on the phone to enroll, but no one really counsels you through those options. And so we're super happy to be that solution to that. And even more thankful to have the support from, the Administration for Community Living and CMS and all of those box tops that you mentioned. So absolutely.
Yeah. ACL has been a great partner. They're a relatively new agency. They may have been formed with the Affordable Care Act, which created the health insurance marketplace.
Mhm.
ACL does a lot of important work to try to keep people in their communities rather than having to go to institutions or other places where they don't want to be. So we appreciate that. And they give you your funding, federal funding. It used to be us, but now it's ACL. So
Yeah.
yeah.
And we appreciate that. ACL used to be the Administration on Aging, but since their services encompass more than older adults, they moved to a more apt title. And we do have a question that's come in on our Facebook page. Janine wants to know, she says, good morning. And does Indianapolis have a local CMS office?
We do not. As local as it gets is our Chicago office. There are not, we don't have local offices like Social Security does. I guess we consider you the SHIP as our local offices, because you understand the program really well. And in a lot of ways, you understand it practically as well or better than I do. You personally encounter all of these bizarre situations of all the enrolling. I know the rules and stuff for enrolling and when's the best time to enroll, but you actually see all of these. I'm sure there's a lot of bizarre situations that pop up in anything about the Medicare program, and you're just prepared to deal with that. So I know you're located throughout the state, in every state and territory in DC, and you really are our field offices for the Medicare program.
Right. Thanks, Janine, for watching this morning and for posting a question.
Yes, thank you, Janine.
And just to clarify, and correct me if I'm wrong, but we do have that face-to-face and that local, kind of like what you said, we're kind of your solution for those field offices. But then, we are greatly supported as far as information and updates and webinars and, protocols and guidelines and all of that through you guys. So we kind of carry that information on.
Right.
And then, kind of like what Gregg did say, we are in every state and territory. And here in Indiana, we're very grateful to being housed within the Indiana Department of Insurance. And then we're very grateful to our volunteers and our partnering agencies. So basically the way that SHIP is provided throughout the state is organizations that have partnered with us to provide a place for a volunteer counselor, or what we call voluntold, an employee of that organization, to provide that free SHIP service. So it is a free Medicare counseling. And then just like we have Gregg and CMS on today to kind of put everything full circle, how we're supported and how we're implemented. So all of these acronyms can.
And we've got something fairly new cooking with CMS, a real direct partnership up in Megan's area. We're doing a pilot project. Megan, why don't you tell us just a few words about what we're doing up in your area in Northern Indiana and who those people statewide could be helped?
Yes, I would love to. Thank you. Yes, so there is a new pilot program that is being targeted in a couple of my zip codes up in South Bend, in the Notre Dame area, and then the west side of South Bend, for those that are familiar, by the airport, by the toll road area. And we are working on providing outreach to population in those zip codes that have Medicare to inform them of assistance programs, Medicare Savings Program and Extra Help, which you may have heard us talk about before. And we will be talking more about in-depthly at the end of the month on our Medicare Monday. And to talk to these individuals to see if they meet the income and asset guidelines to qualify for these programs that will help pay for your Part B premium, maybe co-pays and deductibles, and help with your medication costs.
Right,
These
so
are
it's
very.
It's
Oh,
an
go ahead.
outreach collaboration with CMS, and Megan is the lead for that project here in Indiana. And we appreciate working with CMS in that way. You've brought together some local groups who might have some interest in that. So we thank you for that, Greg. And I know Megan has been working really hard on her outreach.
Oh, I know. It's really important. As Megan said, it's a pilot program that we're running in the South Bend area and in the Chicago region. Every CMS region picked a community to do this pilot. And it is very important. We're trying to see how we can better make people aware of these important Medicare savings programs, because we know that there are a lot of people who are eligible for them, who can benefit from them, who aren't enrolled. And that's probably because in most cases, they're not aware that these programs exist. The names we give them, Quimby, Slimby, QI, they're
Or
that really helps us out. Yeah. Yeah, it doesn't really help us out. It's like you're a qualified Medicare beneficiary. That doesn't, but what's important about that is, like, if you have limited income and resources, if at the QMB, Quimby level, Medicare will pay virtually all of your out-of-pocket costs that are generally associated with the Medicare program. It'll pay your Part B premium, your Part A premium if you have it. Most people don't, but some do. And it'll pay your co-insurance and deductibles, and it's a great program. And the other SLIMB, specified limited income Medicare beneficiary, I think that's, I don't even remember what all the letters stand. But I mean, that'll help pay your Part B premium. And that's, as we know, that premium went up a lot for 2022, and like that's like $2,000 a year you could save if you qualify for these programs. And if you do qualify for these programs, that $2,000 is a big help to you. That you can use, that you can do whatever you need to do with that money besides pay your Medicare Part B premium.
Right.
So, yeah, we are trying to make that. It is a pilot, and we hope to learn lessons from this pilot that we will use in a newly created outreach program about the Medicare Savings Program, and just overall what we as CMS can do to help improve the programs themselves and knowledge and about these programs and how to sign up for them. So yeah, Megan, we really appreciate Indiana Hoosiers. You are very fortunate. You live in one of a few states that allows someone to have a higher income than the minimum standards for these, be eligible for these programs. And it's a significantly higher income. So it's definitely worth checking out to see if you're eligible for these programs. Don't just go by the information you find on Medicare.gov, which is great information, and it's applicable to most of the people who live in this country. But there are a few states including Indiana, that have higher income limits to still be eligible for these programs. So it's really worth checking out and working with your SHIP program.
Right. And in Indiana, if you just make just a little over 1,700 a month, you might qualify. So reach out to us on Facebook. You could messenger us. You can go on our website. We have an inquiry tab that you can hit and ask us questions, or call our 1-800 number, which we're going to see here as a concluding slide, and reach out to us, and we can do a quick assessment over the phone. So, and we appreciate anything CMS can do to help us spread the word about that.
All right.
Yes. Thank you.
We
so
appreciate you
much.
spreading that word. Okay.
We really appreciate you coming on today. And this has just been educational for me as well. I love seeing these because I always learn something. So thank you for being on, and it was definitely very important. That's actually in one of my slides when I present to the public is, don't always Google the Medicare Savings Program, or not everything you see on Google is right, because Indiana is one of those states that has that higher limit. And so I'm so glad that you shared that, because that's something that we definitely want our viewers and our Hoosiers to know about. So yeah. So, well, ladies, I think we'll wrap things up. What do you think? All right.
Well, thank you for having me on. It's been a real pleasure.
Oh, we've loved every minute of it. We appreciate you coming on today. And this is our landing slide, just so you know how to contact us. So we've got our SHIP helpline. We've got hardworking individuals in our state office that are answering phone calls, and they can answer your questions. They can mail you out informational materials. Maybe this presentation has sparked some questions. And we can mail you out some materials, and then we can locate the nearest SHIP counselor and site or enrollment center near you to help you with your specific situation. We're also available online. We have a website with electronic informational materials, and our SHIP sites are listed on there as well. And if you're watching us today, you probably follow us on Facebook, or have at least seen us pop up on your news feed. Maybe you stopped scrolling and checked us out for a little bit. But we're also on Twitter, LinkedIn, and YouTube. And then our communications specialist, she shares all of these videos on our YouTube channel. So if you see somebody that doesn't like to get on Facebook, or you know of someone that may have really enjoyed watching this presentation, they can watch it later on our Facebook page or visit our YouTube channel to see us. And Megan, I'm going to turn it over to you to talk about next week's, or this week is a double feature, so to talk about Wednesday's presentation.
Awesome. Thank you. And thank you, Greg, again, for coming on and talking to us about CMS. It, like Melanie said, is very informative, and I learned new things as well. But this week on Wednesday, we have, instead of What to Know Wednesday, we have Whom to Know Wednesday. So Susan and Melanie will be introducing everyone to Amy Beard, who is the Indiana Department of Insurance Commissioner, and Cheryl St. Clair, who is our State Program Director of Indiana SHIP. And you will be learning about what these ladies do with Indiana Department of Insurance and Indiana SHIP. So it'll be a very informative and fun presentation.
Absolutely. We're so excited about this one. Just really, May is just full of lovely presentations that we've had, and we're so happy with the speakers that we've been able to have on this month. So yep, so we'll have a double feature with our Whom to Know Wednesday. So we'll be right back here, same place, same time, Wednesday. And then we've got 2 more Mondays, Medicare Mondays this month, and we will be closed on Memorial Day. So there will be no Facebook Live on that day. We will be celebrating and honoring our Memorial Day holiday that day. So I hope that you can tune in, and if any of this is helpful or beneficial, or you have a family or a friend that you know would enjoy these, please help us spread the word. So thanks again to Greg, and happy Medicare Monday to everyone out there watching. Thanks, guys. We'll see you next time.
Bye.